So, welcome everyone to our next episode of our Talkroom series of podcasts, Being Your Best Self. And I'd like to start by introducing my co-presenter, Wendy Castellino. And for those people that haven't watched our previous podcasts, Wendy needs no introduction. For those that haven't had the opportunity yet, Wendy is a highly experienced CBT psychotherapist who's been involved in the field of mental health and well-being for well over 30 years now. So an absolute pleasure once again to be here with you, Wendy.
Thank you very much for that introduction, Ian. And I would like to introduce you, my co-presenter, Ian Stockbridge. Ian is an accredited counsellor with the British Association of Counsellors and Psychotherapists and a founder of Hope Therapy and Counselling Services.
Thank you, Wendy. So these podcasts look at the question of how to be your best self. We do that by looking at the question of mental health and well-being from the perspective of a variety of counselling and therapeutic approaches. But today we're going to be discussing the subject of obsessive compulsive disorder, or OCD for short. So, Wendy, maybe you can just start by telling us a little bit about this condition that we call OCD and how CBT, cognitive behavioural therapy, can be helpful.
Certainly, Ian. So cognitive behavioural therapy, or CBT for short, is one of the most widely used therapies for OCD, short for Obsessive Compulsive Disorder. So CBT involves identifying and then challenging the irrational thoughts and beliefs that contribute to obsessive thoughts and compulsions in behaviours in OCD. So CBT for OCD encourages a strategy called exposure and response prevention, which is also shortened to ERP. And this involves gradually exposing the person to their fears and their triggers and trying to prevent the usual compulsive response. So through this process, individuals can learn ways to tolerate their anxiety, and then to learn to realize that their fears are actually irrational, and therefore this leads to a reduction in the OCD symptoms. And the research states that the CBT treatment is the most effective treatment for OCD, and it states that 75% of people with OCD are significantly helped from CBT.
And that's really interesting, Wendy. Thank you so much for that. So can you just tell us a little more about OCD, what it actually is?
Certainly. So OCD is categorized as an anxiety disorder, and it's dominated by unwanted obsessions. And the word obsessions can include things like intrusive thoughts and images as well. And the word compulsions can include things like rituals or urges or behavioral responses to the thoughts. And so obsessive thoughts and images obviously result in increased feelings of anxiety for an individual. Obsessional thoughts can be really devastating to an individual's personal values and morals, and this is why it can cause so much distress. For example, people with OCD may worry about having thoughts of losing control, worry about harming others. They have thoughts of abusing a child or blurting out insults like racial abuse. And the reason they are so distressing to an individual with OCD is that they are in direct opposite to what the person believes. So they kind of like are often very highly moral people and feel terrible about having these sort of terrible thoughts in their heads. So a bit more about compulsions. So compulsions are repeated behaviors that people feel they have to perform to prevent them from feeling anxious. The problem is that these behaviors tend to be very time consuming and often interfere with their daily living. Some common examples of compulsions would be checking electrical and gas items are switched off before leaving the house. Another common thing is excessive washing your hands many times a day, or hoarding things, or having to put things in a set pattern. Objects in a set pattern is a very common thing as well. What is really interesting is that the research suggests that obsessional or intrusive thoughts are normal. 80 to 90% of people experience unwanted thoughts. But most people have these thoughts without too much discomfort and then can dismiss them easily, and it doesn't interfere with their life. However, people with OCD tend to react to these thoughts more intensely, and therefore try to cope by developing a compulsion to alleviate the anxiety.
That's fascinating, Wendy. Thank you for that. So can you give us some examples of the types of things, the type of tools maybe CBT, cognitive behavioral therapy, uses to help to try to overcome OCD?
Yes, certainly. CBT can really help to give you the tools to manage your OCD. We look at how your thinking impacts on the way you feel, and then what you do as a result, and also how your body responds as well. So CBT is very good at helping you to challenge your unhelpful thoughts, again, often called obsessions in OCDs. And then you learn to resist the urges to act. Again, these are often called the compulsions. And then you can learn to break the cycle. So CBT is very good at giving you a structure to work with, to start small and then to work back up. So as mentioned earlier, the main strategy that CBT uses is called exposure response prevention. So gradually over time, you'll build up steps to help you to face your anxiety and to drop your compulsions. So why is this important? So a way of explaining OCD is actually going back to our old fight or flight system. This system is known as the adrenaline alarm system. So this system will be activated if our brains see a perceived threat. So in the olden days, it will be an animal that wants to eat us. But in OCD, the perceived threat could be, for example, if I don't wash my hands 10 times after using the toilet, I could therefore get contaminated with germs, and then I can catch a horrible disease, and then I'm going to die. So you can see how distressing this is. So the CBT would help you to deal with this by encouraging you to reduce the compulsion of washing your hands to a more acceptable level and challenge the thought that this will mean that they will die. So how this works is CBT is really good at setting targets. So using the above example, the person would be perhaps agree to work with reducing their washing ritual to say 9 times rather than 10. And they would discuss a time when they can actually start working on this. For example, maybe reducing the ritual in the mornings because they need to go to work. That would be an example.
Okay, so I understand that you encourage the person to break it down into smaller, more achievable steps. That sounds a little bit too simple, though. It sounds as though there's more to it than that. Is that right? Is there more?
Yes, there is a lot more, and that's just one example. So another way of looking at it is that there are steps in this ERP. And if you think of it of creating like a hierarchy of ways you're gradually going to work on the compulsions. So the idea would make up a list of all the different situations that would trigger your fear and anxiety. And depending on how complex it is, you could have a separate list if you have a range of compulsions. So say you've got one for hand washing, you'd have a list for that. If you've got one for checking the doors, you'd have a list for that. And the idea is if you think of a ladder, you put your feared situations in order of difficulty. So the best way to look at it is the easiest steps at the bottom, and the more you go up the ladder, the more the difficult challenges go at the top. So the ERP in CBT is all about working up in a graded way. So you work on the first step at the bottom of the ladder, and then you work your way up one step at a time. And it's really important to negotiate these steps in a very agreeable way with the person. And ideally, you don't want the first step to be too easy or to be too difficult. Ideally, it'll be just something doable, just outside your comfort zone, just a little bit of a stretch goal there. So if you're able to face your fears in a graded way without engaging in these compulsions, you actually want to drop these compulsions. And obviously, it has to be graded because you can't start with the most difficult task. If you think of a skill like swimming, you really can't learn how to swim in the deep end. You have to start in the shallow end, and you have to put on a few floats and know how to swim before you actually get successful. So that's a bit like describing ERP. Now, what is difficult is obviously starting to resist the urge from this compulsion behavior is going to be challenging. It's going to be difficult and uncomfortable. But what can really help is knowing what to do and what the research says. So what ideally you'd expect, so the anxiety will start to drop at least within the hour, 1 or 2 hours at the most. So by knowing that the anxiety will drop, that can really actually help you. And how a therapist can help a person is to really encourage them to sort of just stay with it, just to sort of cope with staying with the anxiety and coping with dropping the compulsion until the anxieties have subsided. And then when you notice that you don't need to do these compulsions anymore, it can be so liberating. And what this is called, there's a term for it called habituation. So habituation is when you experience your intrusive thoughts are there, but you have very little anxiety because you've repeated again and again, I'm now washing my hands 9 times rather than 10. I feel okay about washing my hands 9 times. I can't believe I've actually made an improvement there. I don't have to wash my hands 10 times, I can wash them 9 times. Okay, that's great. Where can we go on then? Okay, I can wash my hands 8 times. If I can do it, if I can drop one, I can certainly drop another one. And then actually you can actually see what happens. And then of course it challenges the belief that actually I don't need to wash my hands 10 times. I'm washing my hands 8 times and I haven't got any germs and I'm not going to die. I'm absolutely fine. What also can really help in all these kind of procedures is to actually write things down and keep a record, so that if you have a difficult day or if you feel overwhelmed, you've actually got the evidence in black and white there that you have done this and you've made progress and you have actually exposed yourself to your fears and your anxiety have come down. So that's another little tip I think can be really helpful for people.
That's fascinating, Wendy. Thank you. A really interesting explanation of ERP and how that works. So what about ways of challenging thoughts? Are you able just to say a little bit about that?
Yes, certainly. And that's very key to CBT, even though ERP, this idea of reducing the compulsions, is very important. Actually, helping people to understand their thoughts and challenging them is also very useful. And a common thought that people have with OCD is something called thought action fusion. What that means is that people with OCD tend to believe that their thoughts can cause actions. For example, if you have a thought about harming a vulnerable person, a person with OCD means that actually means you're going to do it. They fuse the thought with the action. Okay, so one strategy that actually comes from another therapy called acceptance and commitment therapy is simply to, if you have that kind of thought, first of all, step one is to accept that a thought is simply a mental process. That's all it is. So you don't fight it, you don't avoid it, you just allow it to be there. Okay. And then the next step is just to focus in the present moment, good old mindfulness there, focus in the present moment. And then the third step, we're to be engaged in activity that's of value to them, which is important to them. A good example would be perhaps if they love playing the guitar, just to go and play the guitar. So it's a different process from distracting yourself from the thoughts. You're just allowing them to be there. You're not kind of fighting them, but you're working on your relationship with challenging the thoughts.
Okay. That sounds like a really good way of thinking. Again, it sounds a little bit simple. Are you able to say a bit about that?
Yes, it does sound simple, and obviously it is the understanding and the practice that really works. But some people just don't really know what to do with their OCD. So actually, once you're actually given a direction by a therapist, then that can really help to clarify these things and actually make things steps sort of clear and simple so that people can actually follow them and understanding them. There is one more approach that I would actually like to mention, if that's okay.
Yeah, of course, whatever's going to be useful to our listeners.
Okay, that's fine. So another approach which I really think is very useful, it's called compassionate focus therapy. And the reason I think this is really useful with OCD is this strategy, this practice, this therapy helps us to really learn to self-soothe and to be kind to ourselves. And that's really very useful when you're working with the challenges of OCD and you're trying to practice this exposure response prevention, and how best to manage that. It's a really good way of helping us coping with the anxiety. So that's another tip that I can give people.
Thank you, Wendy. And that's really interesting again, and may give people just a better understanding of OCD, and some hope, and some really quite effective ways of being able to manage it. So thank you for that, Wendy. So if people are interested in finding out more on the subject, or working with somebody, how do people go about that?
Well, one thing that I can offer people if they're interested, if you go onto my website, wendyc.team, there is a online course you can download, which actually goes through the steps to help you to guide and understand a little bit more, and explains OCD in a more fuller way. So if anybody's interested in that, they can just go on my website and download that. And there's free resources as well. You can become a member and download free resources. What about you, Ian? What resources do you have?
So we have a page on our website. People are very welcome to go and take a look at that. So that's www.hopefulminds.co.uk/OCD/. We'll drop a link to that in the comments below as well. But the Hope Therapy and Counselling team has a really diverse level of experience, offering a variety of different therapeutic approaches, including people that work with OCD in a variety of ways, including the ways that you discussed as well. So people are really welcome to get in touch with us, completely free of charge discussion about what's available. So really just for me to thank you, Wendy, for being here and talking about this absolutely fascinating subject of OCD, and thanking our listeners as well. We aim to be back in a couple of weeks to discuss other mental health related issues. So thank you to everyone.
Many thanks. Thanks to you, Ian, and thanks to all our listeners. Okay, thank you. Bye-bye.